Um, okay, good morning, my colleagues, psychiatric trainees in Indonesia. It's exciting for me to virtually travel, not only in space, but also in time, to the other corner of the world. I say also in time because you are just starting your Saturday while I'm ending my Friday. And thank you very much, Dr. Sain, for your kind introduction. It's for me an honor to open the first meeting of the Indonesian Psychiatric Trainees Association, a newly established society in your country made from and for trainees. 2 years ago, this was just a dream, and you were able to make it true in spite of this current pandemic.
Thank you.
I have no conflicts of interest to disclose. I'm grateful to the Alicia Koplowitz Foundation, which is a nonprofit that sponsors my current training program, as well as the training program of other colleagues in Spain that want to learn and to practice in child and adolescent psychiatry. So I faced the challenge to outline in a few minutes the role of psychiatric trainees during the pandemic to a numerous group of colleagues that are far away physically. I hope these remarks are inspiring for you and for colleagues in other countries in the world. Although my comments will be somewhat general, it's the mission for each of you to give them sense and give them the correct form in your current settings where you are. Although we are in the midst of a fast and unpredictable tempest, we can become better doctors, better persons, and bearers of hope. But first, how did I get here? So in April 2018, I received a short email from Chatur, an Indonesian psychiatric trainee who was eager to get involved in the international collaborations maintained through the European Federation of Psychiatric Trainees, the FPD. Chatur taught me about training in your country and became one of my first colleagues in the World Network of Psychiatric Trainees. The following year, he and Charjanti applied for the FPT Menta overseas program, and she was selected to participate in the European Trainees Annual Forum that was held in Prague last summer. And this is how we three got connected and helped to establish the foundations of IPTA. So the world is facing an unprecedented global crisis. All countries on Earth are in a war, but not against each other, but against a tiny particle with lethal powers, and that has been named the virus producing the COVID-19. What started in a busy neighborhood in China got to affect us all and changed our lives. The global burden of suffering and death is too high. And although some countries are getting better, the global numbers only spew fear for the future. Furthermore, an infectious outbreak is raising a major global mental health crisis. We are all seeing how this crisis is being, how this pandemic is being most challenging to vulnerable groups, those who with pre-existing severe mental disorders and addictions that are facing a lot of difficulties in following up with their care and with their treatment. We are also seeing a challenge in the general population that are facing fear, anxiety, uncertainty, are exposed to a lot of media, a lot of bad news, also a lot of misinformation. And many of them are being infected by the virus and are suffering through the pains of the disease, or are seeing how some of their loved ones are suffering the viruses, and in some cases are dying, and they cannot be close to them. So we are seeing reactions of anxiety, trauma reactions, and depressive reactions, and we as recently the Director General of WHO has warned we might be facing a very difficult aftermath in terms of global mental health um, with the virus. And also, we are doctors, and we are next to all the healthcare workers that are on the front lines, and also other essential workers in the hospital and in other businesses. And we also have the responsible for taking care for our colleagues. In the midst of this pandemic, here we are, psychiatric trainees of the early 21st century. We are part of the millennial generation, born between 1980 and 2000. We grew up alongside with technology. We developed a global mindset thanks to communications across the world. We are very sensible to health disparities and to other social disparities in the world. We are interested in advocacy. We are savvy with technologies, as I say, and that is it's helping us and is equipping us with a capability of developing telepsychiatry, being kind of a leaders in the field, also help older colleagues and mentors that maybe are not so experienced with technologies. And also, many of us are already being active in the social media and have been active before the pandemic. And now, many doctors and many psychiatrists and many psychiatric trainees are acting kind of a psychiatrist influencers, and that is not just to get more followers and to be famous, but it's really to advocate for people with mental disorders and to promote a better mental health in the population, also combating fake news, combating misinformation. So I would say this is the most important message for psychiatric trainees during the pandemic. What's the best we can do? What's the first way in which we can help with this pandemic? So I think definitely what we have to do, our first mission, our first role, is to be what we are. We are psychiatric trainees. We are medical doctors with awareness of the psychological and sociocultural factors, with psychotherapeutic skills. We are receiving training to be psychiatrists, and what we have to do is take the best advantage of the current situation to get the formation we need, to get the exposure we need, and to help the patients that we already have in our services. So, you know, that this biopsychosocial model that has been pretty much discussed in medicine is not just a thing only for mental health. It's really something that should be present in all medicine, because all doctors, and not only psychiatrists, should be biopsychosocial doctors. And that means to take care of the three parts. So biological, we are medical doctors. We have to study biology. We have to study pharmacology, and we have to understand also what are the symptoms of COVID-19 and other physical disorders that are affecting our patients. And also we have to understand what are the biological factors that affect the clinical symptoms we are seeing, and also that predict the outcomes of our treatment. And we also have to take into account the social determinants in mental health, culture. We'll talk about that later. And the psychological aspects. And here, during the COVID-19 pandemic, we talk about this fear reaction, this all this psychological adaptation. Um, so our first mission is to keep learning, to keep training, to keep serving our patients. It's also been repeated now in the World Health Organization: no health without mental health, and the opposite is also true. Um, well, no mental health without health. So it's important for us and for all the health system to take care for and to really combat the virus and take care of the physical health of our patients, also to avoid more psychological well, more psychological distress and more psychiatric disorders. Also, yeah, our training has been disrupted in many ways, and maybe the first reactions we might have are complaining, or just why is this happening to me? I uh, how bad luck I have, because sometimes I just start. For some of you, maybe I have just to start training and look at this. This is not what I expected. Well, COVID-19 is not what any of us expected. This is completely new. We are all on board, and this is a challenge. This is an opportunity if you reframe it. Um, so take advantage of the clinical work you are exposed to now with the changes. If it's psychiatry, or or attention to patients in the inpatient unit with with uh, different adaptations. Take advantage of it. It's an opportunity for you to learn new skills and to help the patients. Also take advantage of education. Many lectures are being switched online, so it's, well, in the part it has some advantages, but also we might be tempted to be distracted while attending a Zoom lecture because we are in our rooms and there are a lot of things to do. There's a cat or wherever. But take the best advantage of education, and also take advantage of research opportunities. I will talk a little bit about the opportunities I have been working on. Keep studying, keep learning, keep teaching, and yeah, some of you may spend now more time at home. There's always a lot of things to do, but yeah, remember you are trainees, and you have to study to understand better psychiatric disorders and to be better doctors. So take the time needed to study. Also, yeah, as I said, yeah, there are new forms of interaction with patients, uh, with many patients through telepsychiatry, either through video conferencing or through phone call. Uh, in other cases, will be face to face, but it'll be different than usual because you'll wear a face shield and a mask, and that yeah, that is very different from a normal um, visit from patients to their psychiatrist, and probably will feel uncomfortable with that, and patients as well. But well, that's what we have. So if it's the phone, if it's the video, if it's face to face with PPE, use whatever you have and excel in the interaction with patients. Try to keep the best medical patient interaction, and to make them feel the most comfortable as possible, to make them feel listened to. Also, yeah, being exemplary in your settings, on the measures to protect yourselves, to protect others, um, in the way you wear the PPE, the consistency. Yeah. Also teaching others that maybe are not that consistent. And also, if some of you are are seeing that you yourselves or your colleagues are not having the proper PPE, it's your role as well to advocate uh, for the protection for you and your colleagues. And well, I hope you don't need to be redeployed, but it's happening in some settings in some countries to this call of all doctors to serve in general medicine with in the front lines with patients with COVID-19. Um, ideally, so we psychiatrists and psychiatrist trainees have a lot of work to do in psychiatry, and the mental health crisis is becoming and probably in the future will be very serious and with a severity that will be comparable to the virus itself possibly. So ideally, we'll work with our patients. We'll keep helping the general population, the healthcare workers. But if at some point they need to redeploy you, so be prepared, be trained. In that case, learn about the virus, review your notes and from medical school about how to use saline infusions or wherever, but be prepared because we psychiatrists, we are also doctors. Um, then the other role, so the first role I said is being a good trainee, keep being a good trainee. I would say the second role is caring for their colleagues and caring for themselves, the trainees, caring for your colleagues and for yourselves, and caring as well, first of all, for the people uh, who are around you, who are immediately around you. I think those who need it most are well, or family members, those who live in our house, or children, those who have children, or spouse. And sometimes, yeah, we can spend a lot of energy in helping people, helping our patients, helping people through the social media. Uh, but sometimes we fall into routine in caring for the people who live with us. And those are our priorities. And also taking care for ourselves because we need to be rested enough. We need to also to cultivate other aspects of our life. So I put here the article of this colleague Rana, who is the representative of psychiatric trainees in the American Psychiatric Association, and wrote this nice piece. There's also an online version in this link I'm showing. And she's also active on Twitter, and she's giving kind of a toolkit for responding to COVID-19 for residents with Serenity, and she's explaining briefly these skills that each of us can develop during these days: acceptance, resilience, communication, connectedness, and well-being. The third role, I say that psychiatric trainees during the pandemic have to be virtuous and culturally competent. So virtue is not just something for ourselves or something to be proud of. Virtue is excellence as persons and excellence in love for others. Um, so it's these days I'm hearing a lot this word being compassionate, this adjective, and being compassionate is something that we have to do better these days, especially with doctors and especially we those who work in the field of psychiatry because they are compassionate by excellence. So this means to listen to the others, to listen to their stories, their patients. Uh, and sometimes you you cannot say many things. Sometimes the pain that the others are suffering is so severe, and sometimes you there's nothing you can say, but there's a value also in being there and supporting and listening. Um, Be also aware, as psychiatrists, we are already um, aware of a stigma in mental health against psychiatric disorders. But there's also now a stigma related to COVID-19. It has many forms. Early on the outbreak, in the first countries where the outbreak was extended after China, there was stigma against people from China or other East Asian origin as potential carriers of the disease. Um, Also, there has been some manifestations of the stigma in many countries, also probably in yours, against healthcare professionals. And yeah, a lot of this stigma is related to misinformation, to fear. Um, so we have to be aware to detect the stigma where we see it in conversations, in our neighbors, in the social media, uh, in our patients. Be very supportive with those victims of the stigma, and also understand where this stigma comes from. That usually doesn't come from bad intentions from people, comes from ignorance, from misinformation. So uh, part of our fight against stigma is spreading uh, accurate medical information and stopping the spread of rumors and myths. Um, Also, part of these virtuous and culturally competent practice is positive psychiatry. So in positive psychiatry, uh, when dealing with each individual, we are uh, we are trying to find the good things that are in there. So because they are not a case with a mental disorder, they are a person with a lot of skills, uh, with a lot of good works, and with a lot of potential as well. So in positive psychiatry, we are uh, rather than focusing only on their weaknesses, on their disorders, we are also focusing on their strengths and on their virtues, and we try to help them develop all the good they have, uh, also as a way for them to heal, part of the healing of their disorders. Uh, and also there's something in which the world can learn a lot from countries like Indonesia, their reactions in disasters like the tsunami, um, where people address this problem as a collective endeavor. And I think there's something that we in all the world are seeing with COVID-19, that this is not a problem of some people. Uh, we know that this is something that is threatening us all, and that we all have to collaborate to to combat it and to ensure a better future for us and and, and the generations after us. Um, so part of fostering the sense of collective endeavor is also to understand and encourage the values of their communities. There's a lot of power inside of the local communities to to care for the people who are sick in there, to and also to develop uh, their strengths. So harness, well, embrace and harness diversity, and I think probably Indonesia is a very good example of the diversity of ethnicities, of religions, of people from so many different islands, and 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 we don't just have to tolerate diversity, but we have to understand that diversity is part of the human experience, and is positive, and also is is an instrument to help communities. Also, using in the community bottom-up approaches. So if you want to help a community in this case it might be dealing with us with a higher toll of deaths, cases of COVID-19, or that are more affected because of the lockdown. So you need to help them develop their solutions, and don't just give them what you think is good for them. The the healing, the solution, the power has to come from them, and also respect wisdom that is in the people. Sometimes we doctors, as we have a very high training and education, we may think that we know everything, and we think sometimes that we know what's best for patients, rather than people who have no education or can't read. But in many senses, there's much more wisdom in the simple people, and we also have to understand that and to learn from them, and also understand the morals, the values, the spirituality, the religion, and don't consider that just as factors, but also as part of the resources that individuals and communities have to 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 tackle their anxiety with the virus, to tackle their financial difficulties, and to support each other. Another role is to be open to global collaborations. So this is something uh, great with COVID-19, that so many people across the world are cooperating in different ways. So this is also an opportunity to overcome to overcome close nationalisms that don't allow you to see what's going on in other countries. Uh, COVID-19 is giving us a bigger picture of the world, and knowing that we are not alone, and that what is happening in the other corner of the world also can affect us, and what we do can also help other parts of the world. And yeah, I wanted to put this example. So recently I got involved in an excellent group of early career psychiatrists from all the continents, all the WHO regions, and see that your country is very well represented here, Soviet. Um, and yeah, we are trying to understand better with the perspectives of different um, different colleagues from all over the world. What's going on with the mental health during the pandemic, and what interventions can be planned and developed to 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 support the global mental health. And finally, the um, the last role of psychiatric trainees during the pandemic, I would define it as bearers of hope, carriers of hope. So there are a lot of things we cannot do during the pandemic. So we cannot predict how long this will last. Nobody knows. There are a lot of models, there are a lot of theories, but at least we don't know, and it's not our job to know it. Uh, we we would like to avoid suffering, and to prevent further damage, but we cannot completely avoid it. It's beyond our hands. This virus is very powerful. Um, we cannot restore what's lost. We cannot bring to life people who who has death, and we cannot restore the help to some people. But there are a lot of things we can do. So let's focus on that. Let's do our best with that. So we can become better trainees, studying, um, working hard, taking care for ourselves, taking care for the others, patients. We can be more excellent persons these days. We can take care for many, especially those who are immediately in our surroundings. As doctors, we can still prevent, treat, and alleviate a lot of suffering, a lot of pain and disorders. And we can support your communities, uh, your country, and the world. I like this quote from The Dark Knight, this movie by Christopher Nolan, Batman. So yeah, here one of the characters, Harvey Dent, says that the night is darkest just before dawn, and I promise you the dawn is coming. So in this case, with the pandemic, we don't know if the dawn is coming soon or later, but we know all the things that we can do, and we are eager to 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 be of help, and keep a positive attitude. And this positive attitude that is joy, is not the joy of knowing that, or trying to think that everything's gonna be okay, but because you don't know that. But this joy is not a joy of being free of difficulties. It's a joy of acknowledging that you are not alone, and making the others know that they aren't alone. We are with them. So after these five roles, I think the psychiatric trainees should have during the pandemic. I want to finalize with a few reflections about the value of psychiatric trainees, of associating as you are doing today. So well, when I started my training just a few years ago, so when you are thinking just of yourself, your problems, your your complaints on your training program, your own challenges and interests, so you can advocate for yourself and make some isolated changes in your conditions and improve your curriculum. But if you start looking beyond yourself and look into the colleagues that are with you training in your hospital, you'll find a lot of nice people. You get along with them. You make a lot of friends with them, and as a group, as a local group, you can bring group challenges and interests, and you can improve more things in your training program and in the way your hospital is managed. So that's the beginning of a teamwork. Even more, if you associate with trainees in your region, your island, in your country, you can create regional national associations of psychiatric trainees, like the one we decided to start in Spain. And that's a lot different from just being a group of trainees in your hospital. With a national association, you can advocate for and give a voice to the trainees of all the country. You can try to influence in improving the training programs in your country, in developing national policies and local research, and do some national health, mental health promotion. Um, but there's something beyond that. There's something better, bigger that you can do. Uh, you can you can go to international networks and federations. So the EFPT, the European Federation of Psychiatric Trainees, has now more than 25 years. Has now dozens of countries, almost all the countries in Europe, and they 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 have an international impact. They can uh, well, bring a voice for European trainees in the continent, advocating for the training programs, and also enabling international research projects, exchanges between hospitals in different countries. So that's why that's why we thought that this idea was not too big, because we thought that if we reach the whole world, uh, we can we can we can get to know trainees from all over the world, and 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 that's why we started with a world network of psychiatric trainees. That was just the first time I presented this picture was in the American Psychiatric Association conference in 2018 in New York. It's my first time in New York. I didn't know that I was going to come back here for longer, um, and only a few people, much less people than are you now connected to this conference, were present there. So this was kind of a dream, but now I'm happy to say that this has become true. This has become a very large project. It's still very young, but some of the goals we have are starting to become true. We are starting to connect trainees from all over the world, um, and to share open access resources. Also, to enabling some online activities, um, and develop some research projects. So showing this, I'm now today very happy of in my name as founder of World Network of Psychiatric Trainees and past chair, and probably in the name of Charlotte Michels, that is now the chair of the network, to give a warm welcome to Indonesia to this network. And yeah, finally, my best wishes for Indonesia. Um, I would like to, some people would like to imagine Indonesia like only with this picture. It's very nice, very quiet. It's kind of the paradise, but there's more than that. Indonesia is also all the people like you that are working hard to serve patients, to serve the general population, to overcome these viruses, as you have overcome other disasters. And and also Indonesia, from especially from today, is also a nation with a national association of psychiatric trainees, and is called to be also a model for other countries in Asia and in the world, in this endeavor to connect psychiatric trainees and to improve our training, to improve the care for our patients, and to improve our countries. So now is Saturday in, as I say, in Indonesia. Is Friday yet in New York. So you are the tomorrow. So I'm very happy to meet you today. Just a reminder, these the 5 roles of psychiatric trainees during the pandemic. So being very good biopsychosocial doctors, caring for others, caring for themselves, virtuous and culturally competent, and open to global collaborations and feeders of hope. Um, I want to end with a small commercial pause. So you are all, except from ECHA, to call to apply to this EFPT Mental Overseas program, um, that is now on the 3rd edition, and wants to bring, well, this year will be online, but to bring trainees from all over the world to participate in the EFPT forum. Those who have been awarded in the last 2 years know that the experience is awesome, and we are happy that that this experience has already transformed their lives. So here is the link, and and probably you have access to this letter. So yeah, thank you. Thanks to my mentors in New York, and other parts of the United States, and in the hospital where I did the training in general psychiatry. Thanks to the Fundación Alicia Koplovich, and thanks to colleagues, so many colleagues and friends. That's the best part of being involved in in these kind of associations, meeting very good people, learning from the others, and making good friends. And thanks to Eka, to Chatur, and to all other colleagues. So I really hope and pray that you stay safe these days, and remember that you are not alone, and you have a lot of power to help your colleagues, to help patients, and to transform your country during the pandemic. Thank you very much.
Thank you very much for the very great lecture from Dr. Victor. That's very mind opened, and I would give you a standing applause. So thank you very much. It's very encouraging, and the way you deliver the presentation to us, it's moving a heart. Also broaden our mind. So anyone from this forum would like to ask any questions? We will open a discussion session. You can also ask questions in the, and you can also ask directly if you would like to get in touch and then ask directly to Dr. Victor. Anyone? Okay, maybe I'll start. There's a interesting thing that sometimes, due to the very severe mental breakdown and very hard mental state in this challenging situation, we can just listen and be there. So what do you think if about the psychotherapy, which is ventilation or asking to speak, more speak, and then is it can increase the trauma of the survivors, or is there any suggestion about that? I mean, how far we can do that kind of ventilation, or yeah.
Yeah, there's a huge debate on trauma interventions, and to what extent this debriefing it's useful, it's helpful. So kind of a general idea is to acknowledge that each person has their own rhythm, their own pace, and their own process of understanding, uh, and and their own process to also to healing, to process the trauma and to healing. Uh, so I would say probably there's a value of being there, being and letting the people know that you're available to help, also to let them know that you know that they have suffered, and usually when people go through the suffering, may yeah may have difficulties in processing it. So you are available there to help, to listen if they want to talk in that moment, or to listen at any moment later. So I think, yeah, the idea was say to give them the opportunity to lead their own process, their own pace, and but showing that you are there, that you are available, and that everything can be discussed. Everything can, not everything must be discussed, but everything can be discussed, and and there's nothing, there won't be any all reactions are and all feelings are valid, and when they express those feelings to you, you have to make this effort in validating. uh, uh, some people can react with anger, some people can react with silence, uh, or depression or wherever, but all those feelings are valid, and we want to understand them, to know that they are part of the process, and also to monitor how they evolve, and when it's necessary to intervene more intensively.
Yeah, thank you for the
Oh,
answers. Yeah,
no problem.
uh, I got, I understand
Ah,
kind of that.
yeah, we have in the chat. Okay, questions.
Yeah. So, anyone would like to ask a questions?
I know through Zoom is difficult.
Yes.
You have a interaction, physical interaction. Um, yeah, I hope that at some point uh, I'm able to visit your beautiful country, now that I'm there, and also that you can visit New York. It's a very messy city, but it's also beautiful and has a lot of things to see, and a lot of good people to meet.
Hopefully someday after the pandemic.
Yeah, yeah.
Yes,
Hi.
Dr. Darian. Yeah, this is Dr. Darian Chipta. Please,
Yeah,
Doc.
yeah. Hi,
Thank.
Victor. Thank you. That was a lovely presentation and an important message for this time. One question from me is, um, what you are working with the Early Career Psychiatrist Forum uh, for the recommendation. Because yesterday I just watched the UN Secretary General recommendation to put forward the concern of mental health issue as an integrated part for this COVID-19 response. Perhaps you would provide some essential elements of the recommendation from your working group. Thank you.
Okay. So we are kind of investigating different aspects. On the one hand, we saw that there's a need to develop further telepsychiatry. Of course, the world is very heterogeneous, and
Mhm.
obviously there are some areas where people don't have internet access, or 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 don't have the means, but there are, yeah, there are alternatives, and in any case, it's good for the government, as they are investing a lot in PPE, and they're investing a lot in in research for vaccination and for other things. It's also important that they invest in mental health, and they know that one way to invest now in mental health is to making telepsychiatry accessible to all the patients that
Mhm.
cannot go to the on-site places, or
Okay.
where the facilities are closed. Another thing is, so yeah, that's, let's say, one of the priorities with telepsychiatry. Also regarding telepsychiatry, I would say that it's important because for many people, telepsychiatry is very new. So many people are not, obviously are not trained on how to do it, on the best practices. So I would say it's important for each, maybe for each national association of psychiatry, or for each regional section of psychiatry, to develop kind of recommendations, best practices, and to make them available to all the doctors, all the psychiatrists and trainees that are working there. And those recommendations will be specific, will be tailored for what is actually available there. So that's regarding telepsychiatry. Also regarding stigma, that is another topic that we have studied. So there are, yeah, a lot of things that can be done, but most importantly, educate the people. Also, yeah, trying to present news about COVID-19 in a balanced way, because there are a lot of bad news, but there are also some positive news, and there are some more neutral news. But I think probably it's not good to overload the people, to give them, the people, always messages in the TV about bad news and deaths, and see how dangerous it is, and see one, and focusing on bad stories. See this doctor that has died, or see that. Also showing stories of recovery, stories of people that have recovered, and the stories that show that people with COVID-19 are not extraterrestrials, are normal people. Some of us really have the COVID-19, so we have to be prudent. We have to follow all the recommendations on the physical distancing, but that doesn't mean to reject the people with COVID-19, or to reject doctors. It just mean support them in a different way, and be aware that they are not different from us, and we also can have COVID-19. And I would say, yeah, a third issue that is concerning is suicide. And yeah, there's still not much evidence on what's happening globally with suicide, but there are some reports and that suggest that for many people, these new conditions of lockdown, quarantine, and also these financial difficulties are stressing many people and putting them on higher risk of committing suicide. So I think it's a priority also to monitor and to put efforts to prevent suicide. Hope this answers your questions.
Thank you.
Cool.
Yeah. Is it helpful for you, Dr. Darian?
Yeah, excellent. Thank you.
Yeah, thank you for the picture. Okay, one last question. Anybody would like to ask? It's already AM in Jakarta time, and then we already 1 hour and 15 minutes with Dr. Victor here. So maybe there's one message for all of us. Okay, we have Leonardo.
Yeah, thank you, Dr. Eka.
Yes.
Yeah. Hi, Dr. Victor. Thank you very much for a very insightful presentation this morning, and also in maybe afternoon in the US time. And I think that what we have presented as breakfast many informations about the suffering, that the problems and the strugglings that we are facing psychology is also happening as in everywhere around the globe. So I just want to ask about your opinion as a psychiatry training residents. How are we going to deal with these kind of problems? Because I think regarding to the questions from Dr. Darian previously, that actually what we see now, the problem is is something global. So in your opinion, what kind of action that we could take together as trainee residents in order to cope with these problems? Because I think if we, as one by one, everyone of us also has our own struggles to take on with the COVID pandemic problems. So do you have any suggestions what an action that we could take together? Thank you very much.
Yeah, as a group, as an association, you mean? Well, as this actual group. So I would say, yeah, keep connected. This was one of the recommendations of this Dr. Rana from this fellow from the United States. Keep connected. Talk a lot to each other. You're a wonderful group, and also being mindful, being of what's going on with each of the of the members of the group. Taking, yeah, you have to know if any of you are struggling. If that's the case of any of you, I think that's valid. And so this might be long. So at any moment, each of us can break down emotionally, or can have the virus and need to be hospitalized, or have a family member. So I think it's good for us to keep connected, to know what's going on with the others without invading their privacy. But feel free to speak to each other, to tell your struggles to the others, because they probably won't be able to go to your house and to help you, but there are a lot of things they can do to support you. And the most important is to be connected, to know that other people are hoping the best for you, are talking to you, are, if they are believers, they are praying for you. So I think that's very, very, very helpful. Keep also this interest in learning, together as well. Maybe there are some groups in the EFPT and in other countries, in some countries, they are doing some activities online, not only to meet but also to learn together. For instance, journal clubs, or other activities in which you will meet the trainees and say, well, what's going on, what's the updates, and let's learn something together. That I think keeps the spirit of team, and the spirit of family that is important for you to have with each other. And and what else? Yeah, and focus a lot. Use a lot this reframing. So when you see a difficulty, try to see what can you do, what's the opportunity, and the challenge, and what you can actually do. If you think a lot, and if you think that you can immediately solve everything, all the problems and injustices that are going on around, you will burn out, and you will become frustrated. You have to aspire to that, and you have to know that that you want to change those things. But first, make sure that you are improving yourself as a person, and you are taking care of those little things every day that you can change and that you can do. Some days, focus on little things. Some days you'll go to the hospital, and you'll be very tired because you have been in a night shift, and the patient is coming. When patient is coming to see you, and maybe the patient has no psychiatric disorder, but is just afraid, or has somatic concerns and things that have the virus, but you think that, you see that it's perfectly healthy. So if you are tired, maybe your reaction is, yeah, I'm gonna be rude with this patient. I want to dismiss it. But if that moment you put this little thing, oh, I'm gonna listen. I'm going to treat that person as they deserve. And probably, yeah, at the end I will dismiss it because it has nothing. But I will treat that person as it is, as a human being. So all the little things you can do. That's what you have to focus on to be better. Hope it solves your question. And also, yes, as an association now, the new association, if you see that some colleagues are struggling, that some colleagues are not protected enough, or you now have a voice for you can speak up for trainees in your country, and you are doing that. You are not doing politics. You are defending yourselves, and you are defending your colleagues, and you are uh, advocating for your patients, because if you are okay, if you are working well, your patients will be treated much better.
Yeah. Thank you very much, Victor. I think it's a very strong point that you mentioned about what we have done now actually is part of how to build this sense of uniqueness as the whole, using the internet and the technology advancements. And you did mention about how we could advocate. So maybe let me make some quick questions to you. Do you think that this kind of action that we took, like through the internet, and also, like I could say, the term of telemedicine and telepsychiatry is quite effective for nowadays? And the second is, does the advocation also could take process in this kind of platform, like online advocacy? Or what do you think in terms of psychiatry and how we advocate for ourselves as well as how we advocate to our patients? Thank you.
So yeah, on the one hand, yeah, you will have the telepsychiatry. So telepsychiatry, yeah, there are different ways. In many places is limited, but telepsychiatry for many patients is what they have actually. What the only thing they have, and the alternative is having nothing, and that's a risk for them, because they are missing that opportunity. So we still know little about telepsychiatry, although there is previous experience, previous research, and possibly is in many settings is not as good as it could be a physical interaction, but it's what we have for many patients. So let's try to do it very well. Let's try to offer a very professional service, and I think people appreciate it, and for many cases, and for many patients, people just need to be listened to talk, or they have some disorders, some issues that can be, at least for now, can be dealt with very well through a phone call or a video call, and yeah, and regarding this advocacy in the internet, in the social media, yeah, so we have to take advantage that we are already, many of us are already there on Twitter or on Instagram or wherever. So and we are people who are there, and are people who know about mental health, who have who know patients, and who know what's suffering, what's human suffering. So we can when we see stigma, we can combat stigma. Usually don't engaging with people that are just saying awful things in the internet, but I think it's better to use a positive attitude. So promoting positive messages, hopeful messages of hope, That this is one of the roles being bearers of hope, and messages of also of common sense and and of accurate information versus disinformation.
Perfect. Thank you very much, Dr. Victor.
Yeah. So is it okay, Dr. Leonardo, or anything else?
This is perfect. Thank you very much, Dr. Victor.
Yes, that's a
Thank you.
very perfect explanations from Dr. Victor. Yeah. So we still want anyone want to ask, but we already have a limited time here. So thank you very much, Dr. Victor, for the lecture. It's very nice and impressive for us. And would you like to add one message in the end of your session?
Well, I would like to say, yeah, enjoy this morning meeting, and be sure, take advantage of this. Be sure that what you are doing here is important. It's something that Eka realized when she went to the FPT forum, and I realized many times when meeting colleagues and when developing this kind of efforts, of associative efforts, to see that what you are doing there, it might just seem a reunion of friends, but no, it's more than that. It's a reunion of friends, but it's very important, and what you are discussing today should have an impact on what are you going to do tomorrow, how are you going to how are you going to work tomorrow, and keep this good spirit. It's easy to have a lot of motivation when we meet each other and we have a lot of ideas, but then it's difficult to keep up with this motivation on a day-to-day basis. But yeah, I started my training in a small city in Spain, and I didn't know when I started that I was going to be talking to Indonesian trainees a few years later, and I didn't know about many other things that already happened through the whole network of psychiatric trainees. So all the small steps you are taking in favor of trainees are important for you, for your colleagues, and for the generations to come. The generations to come will look very closely at your example, and will benefit a lot from your example. The first steps of putting together an national associations are very hard. There's a lot of work, you have to build everything from scratch, and then when the others come, although trainees are always changing, but they will find that the hard part has been completed, and they will be able to expand to these efforts and to go beyond. Don't be afraid. It's normal. Generations to come have to go beyond what we do. And that's great. It's human development. Thank you.
Thank you very much for the message. Yeah. So this is the end of our lecture session with Dr. Victor Pereira-Sanches. We are very happy to have you and really appreciate of what you are doing to us, to encourage us and to give us a knowledge about how the role of the psychiatric trainees in this pandemic. And as a conclusion from your lecture, so it is important for us to stay connected and stay strong, and no trainees here is alone. And then we need to be brave to talk to each other, to get sense of we are listened by others.
Thank you very much. I hope you have a nice meeting. And it was great to say this was a great end of my day and start for your day. Thank you very much from New York. To take care for you.
Okay.
Bye.
Excuse me.
Yeah.
Last session, photographs for all. The video for all, and we will take a photograph.
Take a picture. Great.
Yes, take a picture.
That'd be great. Yeah.
Make if you would like to make the video open, and I will take the photograph by the counting of 3. Everybody's ready. I think there's some who still have those. Can you please see those? We will take pictures with speakers here from New York. Okay, on, videos on. On my counting, 3, 2, 1. Once more. Wait for a second. Okay, once more. 3, 2, 1. Thank you very much, Dr. Victor, for the time, and have a nice weekend in New York.
Thank you very much. You too. Thanks to all. Bye. Good to meet you soon. Bye.
Bye.